1 o'clock, so let's start now. Welcome to the Indonesia Project's COVID-19 webinar series. My name is Arianto Patunru, and I'm hosting this event with Nurkamala Mulyani and Baskara Adiwena. We acknowledge and celebrate the first Australians and pay our respect to the elders past and present. We are grateful to the support from the Australian National University and the Australian Department of Foreign Affairs and Trade. Today, our topic is about the high frequency monitoring of socioeconomic impact of COVID-19 on households in Indonesia. And our speakers are our colleagues from the World Bank, Ririn Purnamasari and Bambang Suharnoko Sjahrir, Koko. So they are going to report their, I think, very nice new data set based on high frequency surveys. And as usual, we will have a question and answer session after the presentation and discussion. And but if you want, you can write your question anytime on the Q&A box, not on the chat box, and we will attend to them in the Q&A session later on. So with that, let me first invite Ririn to start the presentation. You can share your screen, Ririn.
Okay. Terima kasih. Let me stop my video first, and then I'll share my screen here. So have you seen my screen now? Yeah, okay. So selamat pagi, selamat siang, everyone. Thank you for the opportunity for us to share with you the findings on our study regarding the high frequency monitoring of socioeconomic impact of COVID on household. So as a quick background about this HiFy, we call it HiFy, we know that the COVID-19 crisis has severely impacted welfare and livelihood of people. And the Government of Indonesia has already put in place a number of measures as an effort to mitigate the impact of this crisis. The primary challenge is actually how to ensure that these measures reach as many as those in need as effectively as possible. It's a very difficult task. And for that, of course, going to be high need for timely and also detailed enough information to understand how this crisis transmits to the populations. And that information could be used to inform the policymaking process by identifying what are the gaps that actually require scaling up or even redirecting on some policy responses. So to respond to this is why we do the HiFy. And quickly about the survey, we actually worked implementing this HiFy survey in collaborations with SurveyMeter. So it's a very great collaborative work. This survey is designed as a rapid, initially planned for 15 to 20 minutes, but because of the request of the high demand on including many additional questions, and then we extended become to 20 to 30 minutes for an interview to about 4,000 households across 40 districts and 35 cities in 27 provinces of Indonesia. As a sampling frame, we use the urban survey, rural poverty survey, and digital economy survey, all survey from the World Bank that has information on household phone numbers. We do the stratifications taking into account factors that likely affect the different severity of the COVID impact on households, such as where they reside, whether it is in or outside Java, urban, rural, male, female headed household, and also the education level of the head of the household. We know that in Indonesia, Susenas is the golden standard of the representativeness of on assessing socioeconomic conditions of Indonesian households. So that's why that we're trying to compare and use Susenas as a weight for us. And as we see from the right graphs, the distributions of the key household characteristics in our HiFy survey are very close with the Susenas survey. So such as in terms of the household head sex, educations, age, including representativeness across regions. So this, we confirm confidence in representativeness of our HiFy sample, and therefore the level of estimate that actually produced from this survey. So far, the HiFy has been implemented 3 rounds. First round was in early May. The second round was by end of May to early June. And the third round was by end of July and early August. In average, we usually implement this survey as about 2 weeks. The modules are rotating because we cannot keep all modules in one round because it's only 30 minutes. But covering topics on knowledge behavior, employment, food security, access to health, education, coping mechanisms, safety nets. Only one module that actually we ask continuously in all rounds, which is the food security. So this is really great news. Many thanks to our respondent who have consistently participated in our survey since May. Yeah. And this made the HiFy survey has a very high response rate, 92%. I think this is the highest ever of the panel phone survey that ever taken place. With such high response rate and the random of the attritions, low and random attritions, we can still be very much confident with the HiFy representativeness. And therefore, in conducting this analysis, we can also keep in some indicators that we ask continuously or ask in several rounds, we can have the panel analysis. And for the panel analysis, we can still have about 3,900 plus panel household as survey respondents that actually we be able to interview throughout the round 1, round 2, and round 3. So just before we present the findings, I think it will be important for us to show you where our survey on the timeline of the COVID-19 development in Indonesia, along with some of the announcement on the key government measures. So as the background, you probably already familiar. This is the stringency index from Oxford that records how the response of the governments becoming stronger or weaker over the course of the outbreak. So the index uses 17 indicators on health, economic, social measures, policies. As an example, for example, here in May, this is when the first time we launched the survey. This is implemented when the government just put in place strongly the containment and closure policies, and some social assistance just started. So you can see that the very high graph on the back because it's very strong containment and closure policies. On the other hand, on the third round that we did in July, August, we conducted when the policy on movement and closure were mostly already relaxed. And at the same time, several new income supports beyond the standard social assistance program have been dispersed. This is also the time that new normal started to be implemented. We can see how the impact of this. So let's see the impact on the employment and income, how it's been influctuated since the pandemic. One channel of the COVID-19 impacts on household welfare can be measured through the change in breadwinners' employment. So in terms of employment, we actually only ask the main breadwinners, that mostly head of the household. Yeah, so not everyone in the household who work. So only looking at the change of the breadwinners' employment and income situations, actually we can have a sense about how is the impact in the household employment and income and overall. We compare their employment and income during the survey, compare with the situations before the pandemic. So we put the state in February 2020. So if look at this, the one in the middle, yeah, the one on the pre-outbreak, we know the 100% of them. So we only ask the main breadwinners actually work in February 2020. And then in round 1, which is the one in the middle, we can see that there in May is about a quarter of household breadwinners actually stop working. Yeah, this is mainly because of the business closures due to COVID legal restriction. Then starting in June, when people start to become more mobile as the economic activities resumes and business offices started reopening, all activities starting there, more than 3/4 of primary breadwinners who stopped working in May have resumed working by August. And about 70% of them actually return to the same jobs as they had before the pandemic. On the other hand, about 6% of those who continue working in May had stopped working in August. So as a result, overall, 90% of breadwinners already working in August, and only 10% of the primary breadwinners has stopped working in August compared to 24% in May. Those who stopped working in August actually mostly still because of the economic hardship due to COVID, such as laid off, business office closed, furlough, but some also because of seasonality or casual work arrangement. This is a very common that actually they're not always having jobs or working throughout the years, even not in the crisis situations. Employment recovery is also observed across all types of work. So in May, actually those with non-farm business face high probability to stop working. Though if we're looking at in terms of the contributions of those who actually stop working, majority of them come from wage workers. In August, as you see, the graph on the area on the right, yellow, green colors getting bigger on the right-hand side than the middle one, but still have the gray color there, yeah, the 10%. So that makes, except for agriculture, share of employment in non-farm business and among wage workers are still not yet reached the pre-COVID levels. Nonetheless, I think this is still quite interestingly pleased to see how the recovery in non-farm business, which in round one, actually non-farm businesses had been hit the hardest. And in round three, on the other hand, are recovering better than others. The incidence of not working in non-farm business fell by 75%. So it's quite huge. If we look at by sector of work, in May, workers and enterprise owners in industry and service sectors are more likely to stop working. In August, employment in all sectors are recovering. And again, by comparing how the area of each color changes, we see the service sectors has improved the most, with the incidence of workers who stop working in the service sector drop to below 10%, comparing to industry like manufacturers and constructions. The incidence of workers who stop working remain around 15%, even though this is after 50% improvement. While in May, we see variations in the incidence of stop working by rural, urban, regions, education level. Yeah. In August, since employment significantly recovered across all household characteristics and locations, we don't see those differences across groups anymore. All equal around 10%. And as in round one, actually, some who continue working in August also be able to do so because they switch jobs, which is more likely among low-skilled workers. So as you can see here from the Sangye graph, it's quite messy. Yeah? It shows how people change from one work to the other. And even some have to go through a period of stop working at some points. So continuing the trend of switching jobs in round one, agriculture remains as a partial buffer, with many wage workers from service and industries switching to farm businesses. Now, there is also another signs of employment and economic recovery from employment side that we can also see here. through lower income, lower incidence of income reduction. So we can see that across sectors, the largest drop in the incidence of income reductions is actually also again in the service sectors, with nearly 20 percentage point. But overall, the incidence of income reductions is still high, it's still around nearly 50%, which means that the full recovery to pre-COVID level is still a long way to go. Even more, if we see in terms of amount of income reduction relative to pre-COVID. So breadwinners who continue working by August, still experiencing income reducing ranges between 35 to 50% compared to their income before the pandemic. So those who working in transport, storage, and communication experience the largest loss. Looking at type of work, non-farm business, which were hardest hit in May, have experienced the greatest improvement in August. Though apparently non-farm business also remains the type of work with the highest incidence of income reduction. Despite recovery, DKI Jakarta and urban areas remain more severely impacted compared to other locations, and lower skilled workers continue to be worse off compared to the more highly skilled. So that's all that can see from the employment. We see positive signals there. Let's see how the food security evolves. And apparently improvement also can be seen in food security. Here we use two measures, to proxy the food security conditions: self-reported shortage of food and eating less than they should due to lack of money or other resources. Looking at these two measures, we can see the decreasing trend of the prevalence of food shortages and eating less, from round 1 to round 3. However, in August, there are still 24% of households facing food shortages and 30% of households who still reporting eating less. And if we focus
sorry,
on
Ririn,
the food, yes?
Sorry, just clarification on the previous slide on the eating less. Is it just because of less money now, or also because of access?
We specifically asked about lack of money or other resources.
Okay, thank you.
Yeah. So nothing to do with access to supply side, market or something. Right, so if we zoom in only like at the food shortages, I mean, like, again, we use the food shortages because in general, food shortages are deemed more severe than eating less. And two measures are actually highly overlapping. So for example, like 87% of households who experience food shortages also eating less. So if you look at on the prevalence of food shortages across household characteristics and across rounds, while in general, the state of food shortages in most households already returned to pre-COVID levels, which is, you can see from the graph, shown by the horizontal red lines and cross the vertical lines. This is not the case for households in the bottom 40% in urban areas and in outside Java. Food shortages also more likely among households experiencing income shocks. Here, income shocks in terms of stop working or continue working but experience income reductions. The food shortages prevalence also likely to be higher among lower educated households and those in the bottom 40%. So all of this actually like indicating that the current food insecurity in Indonesia seems due to affordability problems, less about the supply side issues. And based on the way how we ask on the severity of the food shortages, we use for frequency measurements. We ask whether they often, sometimes, seldom, or never experience food shortages. We can see that underlying the significant improvement in food shortages overall, there is high churns. There are still 13% of households that went to the opposite directions, right? Well, are they improving? They are worsening. And in August is still about 30%, which is not much different from previous round, from round 1 to round 2, which is still about 14%. So those how employment and food security evolves over time. I will pass on now to my colleague Coco, who will share with you the situations related to access to health. Please, Coco, floor is yours.
Thank you very much, Ririn, and good morning, good afternoon, and good evening to everyone. Again, just want to say thank you very much for the opportunity to the NU Indonesia project to allow us to present summary findings of our high frequency survey. And let's turn our attention to health. In the second round, we asked whether in the last month, the households needed medical treatment. And if they did, whether they can access them. And we are happy to find that as of early June, about a quarter of households who needed medical treatment in the previous month, almost 90% of them were able to access them. But still, among those who needed medical treatment but could not access them, they reported that lack of money is the main issues. Also, when we looked at the households who experienced more difficulty in terms of accessing medical treatment, we found that lower educated households are among those who experience this kind of difficulties. And in the third round, we asked households who needed access of services such as immunization, prenatal care, and TB treatment in the last month. And we are also happy to find that majority of them actually able to access, and the ability to access health facilities for immunization was actually similar across different household characteristics and location. However, we need to note that there are still 25% of households who needed immunization and 17% of households who needed TB treatment that could not access them. And this is, of course, an indication of disruption them not being able to access these facilities. And we found that closure of health facilities, or in some cases, limited access and opening hours, because as you know, some of these immunizations services are provided in facilities such as posyandu, such as puskesmas, which may have limited opening hours, or in some cases, our health colleagues and Ministry of Health also reported that some posyandu also closed. So these are one of the main reasons, as well as the fear of going to health facilities because they're afraid of being infected by COVID-19. Now, next slide. Hello, can you hear me?
Yes. Is Ririn operating the slides?
Yes, I already changed it. I don't know. It is. I already changed to the next slide.
Okay.
Coco, you cannot see this?
No, now I can see it. Sorry. It's
Okay.
Again, that is why I could not turn on my video, because the internet connection is a bit unstable. Okay. So yeah, in the survey, we also asked about the extent that households use online health consultation through various platforms, online platforms in the last month. Due to the pandemic, they may be able to reach out to these online platforms. And the results show that only 8% of households that actually did. And the main reason, interestingly, is because they prefer face-to-face consultation, which indicate reluctance to adopt such technology in terms of health services. And also that they did not know about this kind of services or how to use them, again, indicating lack of digital skills. Now, let's turn our attention to education. We asked households whether they have school-age children who are enrolled in school, and the survey shows that 63% of households actually have members who are students. And we are also happy to find that the results show as of early June, almost all students were still engaged in learning activities at home since March 2020. And we also ask what type of learning activities that they do at home. And we have variations from completing assignments provided by teachers, watching educational TV programs. And we particularly want to highlight the online learning one, which we use the mobile apps and online schooling as proxies. And we find that 42% of the students actually engage using online school or mobile apps. In terms of by level, the incidence of online learning by different educational level, we see that the incidence of learning with mobile apps or online school is actually higher for secondary schools relative to primary. And it's interesting to find that for primary, there's a significant difference between urban and rural, which again indicate that online learning for primary school students is more of an urban thing. And in terms of online learning itself, we observe there's a large gap in online learning between students in DKI Jakarta that shows that 83% of students in DKI Jakarta are actually able to do online learning compared to the rest of the country. And also we find that students in the bottom 40 are less likely to use mobile learning apps and online schooling. In terms of the constraints faced by the students who did not engage in online learning, turns out that lack of supporting device affects significantly more students in the bottom 40 in outside Java. And this lack of supporting device actually prevent them from engaging in online learning. And for access to internet, limited access to internet, we find that in Jakarta, for example, even though 83% has already been able to access online learning, those out of those who could not participate in online learning, and the main challenge is really the no access or limited internet access. Now, for those who engage in online learning, it turns out that still they face some constraints. Those in bottom 40 and rural areas tend to lack supporting device, and our results also show that the challenge of having no or limited internet access are actually faced by students across regions and between bottom 40 and others. So these are kind of like common challenge across everyone. Now, in terms of how we also asked about household, whether or not any of the household member had to stop working or reduce working hours to take care of the children at home. And our results show that 18% of the household reported yes, they did have to stop working or reduce working hours. And among them, 2 in 3 households relied on mothers. Now, let's turn to safety nets. We are happy to report that as of early August 2020, we find that many households reported to have received one or more of economic relief measures. And we compare our results with the official government targets as published by the Ministry of Finance. And the survey indicates that most programs have actually received their estimated target. In terms of the incidence of receiving economic relief programs by different household characteristics, our survey shows that households with lower educated head, household in the bottom 40, as well as household in rural areas are more likely to receive economic relief programs. Now, when we analyze further the incidence of receiving economic relief programs among households in bottom 40 and those who experience income shocks, and by income shocks, we meant those who stop working or experience reduced income, we find that majority of these households have actually received one or more of these programs. However, it is also important to note that there is still around 10% of households in bottom 40 who experience income shocks that have not received any. Now, again, because we also asked these questions in the previous rounds, it is actually an improvement from the condition in May, for example, because in May, in round 1, we found that around 22% of households in the bottom 40 had not received any, and now we found that 10%. But still, there's still 10% of them who didn't get any, and these unfortunate households, when we drill further into where they are and who they are, we find that most of these unfortunate households are in urban areas, outside Jakarta, and also among male-headed households, which indicate that, again, there's a targeting challenges in terms of deploying the social assistance programs. Now, before we end our presentation and have a discussion, I would like to summarize some of our findings. I think in terms of the employment and income, it is good to see there's positive signals across the board. We see that 75% of breadwinners stopped working in May actually have returned to work, and a majority of them actually returned to their old jobs. And also the employment recovery is observed across all sectors and type of work. Also, we see a sign of economic recovery by seeing the incidence of income reduction is also going lower. But still, we have about 50% of breadwinners who experience income loss, and this income loss ranges between 35% to 52% compared to their income pre-COVID. And the largest loss is actually among those in transport, storage, and communication sectors. And also, it is important to note, I think, that the incidence of reduced income is also more likely among low-skilled workers and those in DKI Jakarta and urban areas. In terms of education, it is good to know that almost all students continue to engage in online learning. However, only 42% actually engage in online learning. Sorry, majority of them continue learning, but only 42% engage in online learning. But then we see there's the indication that students in DKI Jakarta are ahead of everyone else in the country, and also challenges faced by those in bottom 40. So this is a signal that if persists, it can widen further the inequality. Access to health, of course, majority of households still able to access them, but it is important to note still a quota of households need immunization, and 17% of households who need TB could not access them. So this is something also that we need to highlight, the fact that there is a service disruptions. And also, yes, we start seeing that people use these online platforms to do health consultations among 8% of the households. In terms of food security, we also see a consistent trend of improvement, but it is important to note that there are still households in the bottom 40 urban areas and outside Java who have not yet go back to their pre-COVID level of food security. There are still 24% of households who face food shortages and 30% of households who report eating less by August 2020. In terms of safety nets, most social protection programs have reached the estimated target coverage with, the bottom 40%, 90% of those in the bottom 40 reported benefiting from at least one relief measures. But also there's a sign of targeting error, because we still see that around 10% of households in the bottom 40 who experience income shock and still not receive any. So I think those pretty much summarize the kind of policy implications that this survey have the potential to provide to the government, and we're happy to say that the government has been very open when we discuss these findings with them. And these are some summaries that indicates some of the things that they've discussed. We highlight the fact that there's a sign of healthcare disruption. It is important also to note that there's the improvement in terms of safety net coverage, in terms of employment, in terms of food security. However, there are still challenges in terms of targeting of on deploying of the social systems that needs to be addressed, and also the unequal access and ability to do online learning and education, for example, that need to be addressed as well, because again, if not tackled, it will make the inequality worse. So let me stop right here and pass it back to Bang Aco as the moderator. Thank you very much all for the attention.
Well, thank you so much, Coco and Ririn. That was wonderful presentation, and I'm sure there will be lots and lots of studies using this very nice data set. Not to mention your very impressive response rate. I've never seen things like that, 96%. Okay, so we have lots of time and also plenty of participants. So we have colleagues from Bank Indonesia, we have BPS, TNP2K, Prospera, CHIPS, UI, and many others. So let's start the discussion, and I can see Hal has raised his hand. So over to you for first question, Hal, and then after that, Mas Budi. So Hal.
Okay, selamat pagi, Koko dan Ririn, dan terima kasih banyak. This is really interesting and impressive work, and so selamat. Yeah, I think it's pioneering work. So I just had a couple of sort of brief questions, trying to get a big picture story from it. It sounds like you've got, on the one hand, agricultural resilience compared to other sectors, and that's where a lot of the poorer people presumably are still in. On the other hand, you've got the social safety net targeting, which has worked pretty well from your story, but perhaps has struggled a little bit with the B40s and the near B40s. I'm just wondering, overall, on balance, what is the sort of overall inequality story, or is it just too difficult to tell on the basis of this so far? Related question is, can you tell us about the programs which have really been the most effective? I mean, is it really the PKH and the Kartu Sembako, which have been the main ones, and the other ones, you know, Prakerja and all that, haven't really yet had much impact? And also, do we have a sense of the overall poverty numbers, or can we draw inferences on it? So, sorry, a bit too much in the way of questions, but it's because you gave such a terrific, stimulating presentation. Terima kasih banyak.
Okay, that's 2 or 3 questions. So let's just take that now before we
Maaf,
go.
Ya, terlalu
No,
banyak.
that's good. That's good, Pak Hal. And then later we go to Mas Budi. So over to you now, Ririn or Koko, to respond to Hal's question.
Oke, terima kasih Pak Hal. Apa kabar?
Baik,
Thank you. It's always excellent questions from you. Indeed, it shows that agriculture is more resilient. At the same time, safety nets, showing from our survey, showing that safety net is more likely received by those in the rural area than in the urban area, while the shock itself is more severe among households in the urban area. And the bottom 40%, some still not yet receiving it. It's hard, unfortunately, Pahal, to see how the inequality that actually impacted only like how we're gonna draw line from this survey by itself, right, from the HiFy. But if the bank also conducted the micro simulations, ex ante estimate about the poverty, and actually like it's more likely the urban they're gonna hit hardest, gonna experience hardest, and this is apparently also consistent. I don't know, but it's too early, but I mean, like, you know, like the new release poverty rate from the BPS, if we have BPS colleagues here, they probably can explain more. But I mean, the one in March is also showing a slightly increase in the poverty and more in the urban area, right? And this also consistent with the fact that, for example, the incidence of the food security, right? Shortage of food, eating less, they also happen more in the urban area than in the rural area. So I think we need to, you know, like, menjalin cerita, Pak. The findings from one to the other, it seems like a consistent, yes, but unfortunately we cannot really see how it is impact inequality in overall. But from one part of the findings actually consistent with the estimate from the BPS. The recent estimate from the BPS. It's going to be interesting to know if once we get the data from the BPS, hope the BPS can release the Susunas very soon, because it's going to be very important to us to, you know, start triangulating some of the findings with the Susunas data. In terms of the safety net,
terima kasih banyak, Ririn. That's really interesting. Thank you.
In terms of the safety net, yes, we see that actually because the PKH is only expansion, right? And then the Sembago is also only expansions. But there is also a new program, for example, the electricity bill subsidy for the 40, 50, and half of the 900 where actually for the 450, 94% that have the 450 electricity, they already received the bansos, the bantuan, the subsidy. So I think that's actually like boom up, or actually increase the incidence of the bottom 40% who receive assistance. Because if we, the numbers that we presented earlier, that Coco presented, is actually on, we looking at the all measures. So not only social assistance, but that's include the electricity, electricity. But if we exclude that, actually the incidence of the bottom 40% who not yet receive any help is still higher than 10%. It's still about 17%. So yeah, so still the issue of the targeting still there. So that's why we really pointed out, because no matter how good is the, you know, like how much money that the government trying to give to people, it doesn't go to the right people, and then it might not really have a huge impact to reducing poverty and inequality. Yeah.
Great. Thanks very much, Ririn. That's really interesting. Terima kasih banyak.
Good. Thanks, Ririn. Now let's hear from Mas Budi, and then Alika Tuo, and later on Firman Mitular. So Mas Budi, over to you.
Yeah, thanks, Acha. And I would like to also thank Ririn and Coco for the nice presentation. So I have, well, the first comment is that I just wonder why you don't use a lot of cross-tabulation to tell the story about the situation. For example, you could actually do cross-tabulation between food security and whether the person is actually receiving a bansos or not, or social assistance or not, and see how different those two population in terms of food security. And so, and the second issue is that since you say that your data is relatively, in a way, comparable with the Susanas, you could also tell a story about mistargeting. So among those receiving social assistance, I don't know whether you have those income, but you have, this is coming from your previous survey, so you could actually merge with the previous data to tell about their social status. So you are possibly telling about, you know, how much this mistargeting has been happening, which is, that is the issue right now, isn't it, in terms of social assistance. And third is that, well, we know that what happened with COVID in Indonesia is not uniform across the country. The country is just too big to say one thing about the whole Indonesia. The variation is too big, I guess. And so, don't know whether you could write or predict the right weight. So you could tell a little bit more about regional variation on those information that you presented. So that probably will be an interesting story as well. Thank you.
Thank you, Mas Budi. Let's now call the Alika Tuo, WFP. Yes, silakan.
Thank you, Pak Acha. Thank you, Ririn and Mas Coco, for the very informative presentation, particularly also on the food security part, because during this pandemic, actually not many surveys are provides a deep look in the food security status of households. So I think this work is very important. And I think my question has been touched a little bit by Pak Budi. But yes, in your presentation, you mentioned that actually 13% of households experience a decline in food security status. They faced worse food shortages between May to August. I was wondering whether you can provide more insights regarding the characteristics of these 13% of households which experience deteriorating food security status, and whether there has been any relationship between the receipt of social assistance and the food security status of households, and whether your data would also allow for this aggregation between households with under 5 children and their food security status levels. Thank you very much.
Okay, thank you. Let's take those first, Coco and Ririn, before we go back to Firman. So, Coco, maybe?
Ya, I'll answer first, dan
Ririn,
Kok
okay.
nanti nambahin ya kok.
Okay.
Oke, silakan Mbak.
Yang muda ngalah. So, Mas Budi, thank you, Mas. Cross tabulations, yes, we did. Unfortunately, we do not present it here all. So, for example, the questions for you and also Alika, thank you. Similar questions on the food security and how it interact with the incidents with whether they receive bansos or not. It's not significant, Mas. So the answer is not. There is no association. It's not significant between the two. So that's why that we did not present it here. But I think maybe because we also have the same questions when last time we presented with the Ministry of Finance. So I think maybe it's also good for us to present it here, even though it's not consistent. So that's why they know that actually the incidence of food insecurity is not associated with whether the household receives social assistance or not. In terms of mistargeting, yes, because from the previous surveys that we have information about asset and all of this. Of course, we do not ask about income. We know how the income data that usually might not be, consistent. And but using those information, actually, we be able to do the predictions. We use the proximity testing. And so that's why that we able to present, for example, Mas Budi, like the bottom 40%, the middle 40%, the top 20%, because we already know the estimate of their welfare function, right? Where they are in the distribution, right? We do not want to put that, for example, in each indicator by decile, because I think our sample is only 4,000 and not all indicators actually big enough, right? To make it into decile presentations. But just to confirm how it's compared to the Susenas data, the one that we can compare with the Susenas is actually in the social safety net, PKH, recipients of PKH, and recipients of sembako, right? Because this the two programs that actually already done before and after the COVID situation. So when we try to look at the distributions of by quintile and by bottom 40, even better, by bottom 40, middle 40, top 20, the distribution is super close, Mas, between the incidence of the recipients of the PKH in the Susenas and this HiFy, and the same thing with the incidence of recipients of sembako in the Susenas and this HiFy. And we know that in the Susenas, they do not use PMT, right? In the Susenas, they use the actual consumptions. So that's why that I think we feel confidence when we present it in terms of the distributions of the welfare. But again, this is talking about the targeting. Indonesia's program, majority, is still rely on the UDB, Unified Database, they call that one, that been developed many years back, right, 4-5 years ago. And then since then, I think the updating probably is not yet really done much properly or because I think over time, I think this is also information from our colleague from PNP2K, right? That actually over time, maybe only 8-10% change of people in and out, which is for 5 years, Indonesia is very fluid, yeah? People in out poverty is very fluid. So that's maybe the issues. Every time we compare with the Susenas, we compare with the new consumption that more updated every year, which is the database itself. Maybe it's not keep up with the new situation. So unfortunately, because Susenas doesn't have panel, so we don't really know who they are in and out. We only be able to do it, I think, in year 2008, 9, 10, we did that, right? So we did the analysis using the panel. That's super nice because we really know how people in and out, how many percent, 10% the possibility for them to fall into poverty, how many percent from vulnerability to poverty, and so on and so forth. And since then, we will not be able to do it again because there is no panel be able to do it. So that's maybe Koko gonna take questions on the regional variations. Kok, please.
Okay, thank you, Mbak Ririn. Just want to basically, when the last time we had I don't know whether their colleague from 10P2K, but as Mbak Ririn said, when the last time we had a discussion with Pak Elan for 10P2K, he's mentioned that only 8% from the targeting database that was updated. But he also mentioned that there's a possibility that there's a panel in the Susanas March and September. So I mean that's if there's a colleague from BPS who can confirm that that's actually happened. So again, it opened up an opportunity to actually look at this the impact of the pandemic more closely, because going back again to the regional variation, Mas Budi, unfortunately, yeah, we cannot do much more than what we already have, which is comparing DKI, Java outside DKI, and then outside Java. Those are the only sort of like regional variations that we can do given the limitation of our sample size. Also, because of the, like, for example, the incidence of household, addressing Alika's questions, the incidence of households with under 5 children is also rare in our household. So we also cannot we cannot particularly take out those households from our survey, from our data in this case, because then the results will not be representative, unfortunately. Those are the only additions from my side at this stage. Over to Bang Aco.
Thank you, Koko, Ririn. So our next two are Firman and Damar Susilaraya Dewa. Rusan and Anissa, please bear with me. I'll come back to you in the next round. So Firman, you go first. You're still on mute, Firman.
Yeah. Congratulations, Ririn and Koko and the team for the great work. I think this is amazing data, and I believe there's going to be more rounds, so there'll be more interesting findings. So my question is actually already, related to Mas Budi's question on regional variation. I want to know how should we think about the representativeness of the sample, since you said this is coming from 3 different surveys. So from the Jakarta result that you're talking about Jakarta, are those coming only from the urban perception survey or in combination with the other surveys? And also the result on the agriculture as a buffer, is it coming from only the rural survey or the combination of all 3? So I just want some more clarification about how you combine the sample. And second question, are these data going to be publicly available and when? Thank you.
That's a good question, especially the second one. Okay, so Pak Damar Susilaraya, is it Pak or? Sorry.
Thank you very much. Not sure how I can show my picture. Just wondering, a bit similar question. How many? How was the sampling done? How did you choose the samples? And then from those, how many people did you need to contact to get the initial 4,000 samples? And also, really wondering how you why people why they participated, why it was so high, the 96% was it that also participated in the second and third round. Was there did they receive something in return for their time? And I'm just wondering if there's a way to access the first and second round of the study. It's really amazing work, and thank you very much for sharing this.
Thank you, Mbak Damar. So Ririn, back to you.
Okay, Firman and also Mbak Damar, thank you. In terms of the representativeness, yes, for the Jakarta, because for the urban, only looking at the urban area, right? And then rural survey, only looking at the rural area. But then we also have the digital survey, the XLA combine the rural and urban. So there's a mix. There is a mix, but of course, each of the survey designed with their own target. Like for example, rural is more because in the rural survey is also at that time trying to look at more on those who receive PKH. So actually, it's going to be heavy in the bottom 40%. But digital is actually more across, like different level of the welfare. Urban also the same thing, but at that time we focus more on those in the slum area, for example. So there are many there in Jakarta. That already take into account when we did the weighting, right? So that's why that we can say that even even though we use the different kind of the surveys, and then we be able to at least mimic what the distributions that it has in the Susnas. Damar, questions about the sample. So from the three surveys initially, we have around 7,000 or nearly 8,000 households with the phone number, right? And then we already trying to look at to use the stratification, right? So we use the stratification, and then for each of the stratifications, we trying to target how many households are actually for each of the group stratifications. We have at least a certain number of the households. So, and then at the end, in the round one, we be able to get 4,338 households. So yeah, still 4,000, right? 4,000 plus now is around 4,100 something. Yeah. Data, yes, Firman. So we in the process of trying to get the all the like the nitty-gritty process that how we have to release all the data and everything, and especially the bank is very particular in terms of making sure that all the like respondent informations can be kept and all of those things. But yes, we in the process of that. So
and these initiatives are also being done in other countries. Is that right? Really?
Yes. So this the nice thing also, because actually this is the global initiative, Mas Aco. So that's why there are many countries. So even in the region is Asia Pacific regions. We have Indonesia, Myanmar, Philippines, Cambodia,
PNG.
Vietnam. Yeah. So almost all country in the region, even PNG, they also have it. So there are many countries, though of course, different country have a different capacity, right? And number of sample at the same time. But we have a standard questions, that kind of core questions that need to be asked in as much as possible in all country. Indonesia is actually the one that got the first and the one that got the most. We always want. And I think it's also good, yeah. We have the very high response rate. Kudo also to survey meter, like that, consistently trying to call how many times and trying to get. Come back to Mbak Damar, yes, we compensate, Mbak. I think it's just because to compensate the time, right? That it's not much actually. It's only using the phone. Apa namanya kok?
Pulsa.
Minutes.
Pulsa, ya, hanya menggunakan pulsa. So we transfer pulsa. Initially we only like it's really small things, but yeah, but it's good. I hope that I answer all the questions. Yes, we have the round 1, round 2. Actually, what we presented here is the combinations of the all rounds. What we missed that we do not present that, I just realized, is on the coping strategy, which is actually also quite interesting, right? Because the majority of the people, the way how they cope with the crisis is by reducing food consumption. That's the first time when we ask. So we usually, when we ask the coping strategy, we ask one by one, right? But before we do that, we ask just like, what is the coping strategy? So kind of respond that come right away is the majority of them said that reducing food consumption. So maybe that's one of the reasons why the shortage of food or eating less is quite high among the household. Maybe also the precautiousness behavior, right? Because we do not know how long this COVID pandemic crisis situation is going to be like, how they're going to be affected by this, whether they're going to still have the job or not the job next week, next month. That's also consistent with when we ask their perception, yeah, about how afraid they are affected by COVID and the money situation. Maybe you would like to.
Yeah. Yeah, I mean, as Ririn said, we have now the sections on coping mechanisms. We also asked about concerns. We also asked about behavior, actually, and these behavior questions, because we have different rounds, we actually have questions about, in the beginning, what kind of behavior did they do, what kind of behavior that they're aware of. And then later on, we started asking questions about the new normal behavior. Unfortunately, given the limited time that we have today, we cannot present them all. It's a sign to NU Indonesia project, perhaps, to invite us again.
Sure.
But basically, yeah. I mean, no. I mean, and then of course, would be great for us to receive inputs, because as pointed out by Mas Firman and also presented by Ririn in the beginning, that we will have another rounds, because the idea is we really want to use this opportunity to monitor as the crisis evolves. So happy to get inputs as well from the participants here, from the team at the NU. For of course, we would like to learn from your expertise to let us know if there's anything else that will be interesting for us to ask. Thank you.
Great, thanks. So next is Rusan and then Anissa. Rusan, you first.
Thank you, Mas Aco. Thank you, Mbak Ririn, Mas Koko, for wonderful presentation. I have two questions. One is about the success rate from not the attrition, but how many respondents finally accept and willing to be participant from your list, because we had experience myself with Pak Budi trying to conduct phone surveys. Is quite difficult to reach at the beginning out of our list. Finally, it's quite few numbers of people want to participate. That's one point. Second one is about question related to health protocol. I think one of the most important observation right now is to see how people apply the discipline to do 3M, wearing masks and so forth. I just wonder whether the survey also cover that kind of question or somewhere else in the World Bank survey. Thank you.
Thank you, Rusan. Anissa?
Thank you, Pak. Thank you, Ibu Ririn, and also Mas Koko for this study. It is very insightful. My name is Anissa from UNICEF. I have one question and one comment. One of the questions is related with your findings on the social protection. 10% of the household of the bottom haven't received any assistance. I would like to know further about factors, or you can be more elaborative. What are some factors that cause them not receive this assistance?
Okay, thank you. Before you answer, let me read one question on the Q&A box that is from Fania Budianto, our PhD student here. So with regard to the 10% exclusion that do not receive any safety net,
COVID-19.
Okay, so with regard of the 10% exclusion that do not receive any safety net, are they majority in urban or rural areas? If it's mostly in urban area, is it because there is no BLT Dana Desa that should be complementing the other social protection program that base their programs on unified database? So over to you, Ririn and Koko.
Okay, thank you for the questions. Let me answer one, and then Koko might go to the social safety net. On the success rate, as I mentioned earlier, from the whole 3 surveys that we have, actually we have a 7,000 something, right? And then at the end we able to reach 4,338. So I think the success rate in terms of reaching out is about 60%. So it's it's of course it's not easy, right? But once we successfully reach them, and yeah, by the way, we reach them in, like, we trying to consistently calling at least 6 times. If we are not reached to 6 times, and then survey meter cannot say stop. So we say, like, keep trying until get it. Minimum 6 times in 3 different times in 3 different days. Yeah, I mean, sorry, 2 to 3 different days. So it's this is the effort that we're trying to do, Mas Rus'an. So yeah, it's very tiring, but that what we got. I think rewarding. We got 60% of them. In terms of the health protocol, yes. So as Koko mentioned earlier, we also asked about knowledge and behavior. For the round 3, we actually asked the 3M. We asked whether they always wearing masks when they activity outside the house, and then whether they are also always washing hand with the running water 20 seconds, and whether they keep distancing, social distancing, so at least 1 meter away. The findings said that actually 95% of the respondents claim that they always wearing masks, 95%, always wearing masks, and always often washing hand. But this is self-reporting, yeah, and this is more about something that people know that they are asked to do. So I don't know whether it is like really in reality they properly always wear it or not, right? But the sadness is like 5% who didn't do that said that it's not important. So they said that they don't need it. So that's the dangerous thing, right? Even though only 5%, but the way how they see it, it's not needed for them to wear masks. So that's something that we need to know. In terms of social distancing, I think it's about 75%, yeah, Kok, yeah. I think it's about 75% that actually they said they're able to do the social distancing. The rest that they do not be able, didn't do it because they are not able to do it because the environment is difficult for them, and majority of them is actually from Jakarta. More likely that people in Jakarta is difficult for them to do it. And then we also asked whether their workplaces also implement new behavior protocol, right? The health protocol in their offices. And said it's only 65% of workers said that actually their office asked them to always wearing masks. Really implement that, strictly in the office, and the rest is less. The highest is only wearing masks, and even it's only 65%. So that doesn't surprise us, no? The fact that now in Jakarta, since the new normal, a lot of cluster in the office, because once they got the office, they buka maskernya. It's not surprises. They feel safe when they're dealing with people that they know, which is maybe that's the dangerous thing. So that's the health protocol. Koko, you want to take questions on the social protection from
Yes.
Mbak Anissa?
Okay, Mbak, I try to answer both Mbak Anissa and Mbak Fani as well. So basically the question is about those 10% who have not received the assistance and why. And I think earlier in my presentation, in our presentation, we show that those who have not received any in the bottom 40% are mostly in urban areas, outside DKI Jakarta, male-headed and higher educated households. Now, let's see. The fact that they are outside DKI Jakarta, as far as we understand, DKI is among regions that are actually very, they provided the bansos and all kinds of assistance quite a lot among those regions who provided many. So it is unsurprisingly that it's not among the incidence is lower in DKI. Mostly urban areas, male-headed and higher educated households. From these characteristics, looks like that these are indication that this may be those who are not yet in the TTKS, those who are not yet in the unified database, those who are maybe before belong to not so much poor and vulnerable, but now they have become poor and vulnerable. So this is again going back to the targeting issues that we have, the challenge that the government face in terms of updating the targeting database. particularly how to do it correctly if the process needs to be bottom up instead of top down. And again, the questions about the BLT Dana Desa, particularly, yes, in Dana Desa, there is a BLT Dana Desa, but also they have a lot of, in terms of the programs, we have the Sembako Banpres. We also have the Bansos Tunai that basically that are both in rural and urban, and I'm trying to basically reach out to those who do not have the Sembako card and who do not have the PKH. So again, maybe indication that the challenge is really at the urban area to really find this new sort of like poor and vulnerable group that has been negatively affected by the COVID-19.
Okay, thank you, Coco, Ririn. So I understand that our speakers have other commitment now, so I'm sorry we have to stop here. And my apologies to those who raised question in the Q&A, but we could not respond today. But we make sure to forward your questions to Ririn and Coco. So once again, on behalf of the Indonesia project, I'd like to thank Ririn, Dr. Ririn Purnamasari and Dr. Bambang Koko Sjahrir for their great presentation. And thank you all for your participation. So we'll meet again next week. So I'll turn this back to Nuka.
Hi, Joe, thank you. Just a reminder that we will have another global seminar next week. We'll talk about Ben Blank's new book, who will during this COVID area, the Man of Contradiction, with Ben Blank and Dina Raharjo. Thank you. So we hope to see you again next week. Thanks. And I will end this now.
Thank you, everyone.
Thank you,
Thanks, Ririn, Coco,
thanks.
Thanks.
Mas Firman, Pak Hel, Mas Budi.
Thanks,
Terima kasih.